And I don't remember at least seeing a lot of clinics that are specialized in wound care or many physical therapists even. And why do you think that, if that's true, if that's really the case, if there are just like few therapies that are specialized or they're just dedicating to see wound care? And if yes, why? Do you think that usually PTs don't like to work on this area, or they are just not common?
When I teach, I usually ask that question of the group and say, you know, after I ask them, what are the first two words that come to your mind when you think about wound care? And it usually has something to do with smelly, stinky, gross. But the next question is, I ask them, do they think they will ever do it? And out of the classes of 40, there's usually 2 or 3 that are very interested. And so I think there is some folks out there that would enjoy doing it. My daughter included, who just graduated from the University of Tennessee and hopefully will be in PT school this time next year. She's getting into PT school to do wound care.
Oh,
she
wow.
grew up in the office with me and has really enjoyed it, and has been tossing back and forth between dermatology and wound care, PT for some time, and has chosen physical therapy. So I think there's a small percentage of people that do enjoy it. And I think once they get over the initial, oh, that's not what I thought it was, you get the nice benefit of actually seeing improvement. You can measure improvement objectively from week to week. And we have some nice objective tools with, you know, we can do the oswestry, we can do a pain scale with someone with low back pain. But with wound care, you get to lay your eyes on the problem, and it was this big, and now it's this big. And so that tends to be gratifying, instant gratification for the therapist, and I think is motivation why somebody gets into it and enjoys it. The other thing I think they would enjoy is, oftentimes, especially in the rural area, the physical therapist is the team leader. So as referring to the surgeon, asking the surgeon what, or instructing or helping the surgeon to choose which test to perform, is oftentimes the therapist taking the lead. And I'll throw you a little stat out there. There was a study done, it was over 5 years ago, but they looked at 50 United States medical schools across the country, and they received less than 5 hours of education in wound care through their entire training. So when we get out and say, who is going to take care of these wound patients, most physical therapists have quadrupled the education of a MD before they ever get out. And unfortunately, a lot of MDs learn from their internships, and so the information that is being passed down is outdated and unfortunately can be harmful. And so we spend a lot of time being educators, even to our peers. But that can be enlightening for some therapists if they like to have the lead role, and wound care could provide that as well. So I've been helping Benchmark, our upstream rehabilitation, which is what now the 2nd or 3rd largest outpatient provider in the country. And we only have, out of the 1,000 some odd clinics, we only have 16 that actually provide wound care. And that's 16 more than they had 5 years ago. So we've grown it from 0 to 16. That has been a slow process, but yes, you're not seeing it. And I do know that a lot of the wound care clinics used to have physical therapists in them, but they are making more of a financial decision and using a lower cost LPN or sometimes RN rather than a PT to do their, and unfortunately it becomes more of a dressing change, and then the physician is coming in to do oversight, and that's unfortunate.